welcome to the OBGYN's office. Do you have an appointment today? A problem visit. Okay. All right, and can I get your first and last name, please? Thank you. And then confirm your date of birth. Okay. Let's see. All right. Perfect. You are right on time for your appointment, so thank you. Any changes I should know, an address or phone number? Oh, just the phone number. What is it now? All right, perfect. Let me just grab your file here for you. 1 second. All right, so I have your file. I'm gonna go put it in the check-in section, and then Lee, the medical assistant, will bring you back. Take the vitals, get the history, and then you'll see the provider after. Absolutely. You could take a seat right over there. Lee will call you back. Always a pleasure seeing you in the office. You'll just have to wait a few minutes. Oh, hello. What do we owe the pleasure of seeing you again? Of course I remember you. You are literally one of my favorite patients. I'm not lying. Now, we can kind of get into what's bringing you in once we go in the room, but same thing as always, temp check, blood pressure check. Yep. All right. So just stay sitting right there for me. Let me clean off my stethoscope. Now I know you're coming in for a problem visit, but other than that problem, have you been doing okay? Good. Love to hear it. Family staying safe? Good. Yeah, same here. Couldn't be better. And put this in the garbage. Let's do the temperature check first. I feel like I always struggle with this. I don't know why. You're not feeling fever or chills today, are you? Good. Stuck to my glove. Okay, ready? Yep, the usual. Tongue up. All right, of course, normal temp. That's what I figured for you. Let me put this down. All right, I'll put this back in. Here's the cap. All right, and I'm just gonna need you to relax. I won't ask you questions to be sure you're not talking. Just kind of rest your arm. Yep, just like that. You already know. Alright, I'm going to place this around. Perfect. Let's take a quick listen. All right. Blood pressure is perfect as it normally is when you come in, so that is very good. All right, so how about we get situated in room 2, and we'll kind of talk about why you're here. But before you go into room 2, let me grab you a urine cup, just so we have a urine sample on hand in case we need it. Would you be able to pee right now? Good, okay. Kind of matches my scrubs, am I right? But here, this is for you. Leave the urine sample, meet me back in room 2, and we'll kind of figure out what's going on today, okay? Of course, I'll be waiting for you. All right, time to give me the tea. What brought you in today? You want an STD check? Okay. Now, are you having any symptoms at all, or no symptoms? Okay. But a new partner? Gotcha. Male or female? Now, do you know if they've been tested recently or if they're having any symptoms? No? Honestly, it's fantastic you came in. Because at the end of the day, what I always say is the biggest symptom of an STD or an STI is no symptom at all. Yeah, crazy, right? Now, have you been using condoms, or be honest? Okay, so kind of on and off use. All right. Now, when you say that you want screening for it, did you want blood work as well? That includes hepatitis, syphilis, and HIV? Yes, okay. So we'll get you that. And then as far as an exam, did you want us to just run a gonorrhea, chlamydia, and trichomonas off of your urine sample, or did you want a pelvic exam just to be sure everything internally looks good? Pelvic exam as well. Okay, yeah, no problem. It's whatever you want. I just wanted you to know that there were other alternatives in case that was something you weren't really interested in. Works for me. All right. Now, one thing that Leanna really likes me to go over is the whole thing with herpes testing. I feel like a lot of people sort of come into these clinics, and when they ask for routine screening, they assume that herpes simplex is tested for as well. But a big heads up for you that we will not routinely screen for herpes simplex virus unless you were to be having symptoms of potentially having herpes, or you are someone who performed high-risk sexual behaviors, such as having multiple partners, never using protection, that sort of thing. So my job is just to tell you that herpes is not being tested for today, okay? All right. Excellent. And you're on birth control pills as well? Mm-hmm. Any changes to your medical history? Okay, good. All right. I think I got all the information I need. Leanna, the PA, is going to be in to do your pelvic exam for you. I will kind of let her know that you want the GCT testing as well as the blood work. That includes hepatitis, syphilis, and HIV. Okay? Absolutely. Always a pleasure seeing you, and until next time. Hello. It is very nice to see you again. I heard you were just here for a pelvic exam to make sure everything looks good. We're going to be running some STI screening off of your urine as well as blood work today. Okay, perfect. You kind of know the drill for the pelvic exams. You always verbalize with me if you are ever uncomfortable or in pain. I'm going to take the speculum, insert it, look inside of the vagina, make sure everything looks good. If I do see any discharge that may look like BV or a yeast infection, which are not sexually transmitted, I will let you know, and we can always swab you and send that out to the lab. Okay, sounds like a plan. How have you been? Good. All right. And I just want to thank you so much for coming in. I know this is no one's favorite place to be, but it's so important for your health, especially these screening modalities, because like Lee said, a lot of people, they just never show symptoms, and they can have things like gonorrhea and chlamydia. Yeah, it's scary, right? You are absolutely right about that. All right. we're going to use a small speculum, okay? And yes, you know how it works. All right. So what you are going to do is you are going to feel my hands down here now, okay? Now you're going to feel that cold pressure. Yep. All right. So you do have a little bit of white discharge, and you know it could be something as benign as a pH imbalance or BV. So I'm going to do a vaginal swab on you just so you can kind of get the full workup. Yeah. All right. This is what we're going to carry the sample in. All right. You may or may not feel this. I'm just taking some of the discharge out. All right. We are going to be sending that out to the lab. All right, let me take the speculum out. Now the last part of the exam is just with my fingers to note if your cervix is tender for whatever reason, okay? Okay. Let me grab some lubricant. All right, you're going to feel my fingers? Yep. Does it hurt you when I poke back there? Okay. All right, your exam is done. So what's going to happen is I will step out, you can get dressed, you are signed up for our portal, so all of your test results will get sent to you, and of course I will be sure to call you if any of the results are not normal. We are giving some samples of probiotics right now, so this is for you. And please, any questions, concerns, you come right back into the clinic, okay? All right, always a pleasure taking care of you, and I hope you have an amazing day. Thank you.